Aloha, I'm Chrissy. Today is Saturday, September 20th. I'm Nathan. I have to speak again to make sure everything is perfect for Chrissy's sake. Well, that's a good part of our relationship. I want her to explain more about her experience thus far, starting in May up until now. She has had chemo 5 rounds of chemo and 6 treatments. Over time, they have found that the cancer has spread into different areas of her body. Now she is on a new round of chemo. I want her to express how she is feeling and what differences she has noticed so far. She will sign what she has typed up. That way you can listen to her. Enjoy listening while she shares her story. Thank you, Nathan. I want to share from my heart. My emotions and feelings I will share, and that will be enough. I have been dealing with a variety of different emotions every day. Some days are good, other days not so good. I am on a roller coaster of emotions, feelings of sadness, frustration, struggles, and everything in between. Of course, my husband is always there for me. He is so supportive and caring. Of course, he can be annoying sometimes because he's always checking on me to make sure I'm okay. But I know he does it because he worries and cares for me. Just by him observing my emotions and behavior, he knows how I'm doing. My emotional responses to the doctors aren't explicit. He has to explain more. I'm exhausted. Every appointment I attend, I'm really tired. I don't want to talk with the doctor, but at the same time, I feel like every appointment I go to is the same thing. The doctor will ask me the same questions. How am I feeling? Are you doing okay? I understand. He needs to know what side effects I'm experiencing. But the one side effect is that I'm really tired. I feel fine now, but we really want to know what our future plans look like. Doctors will often be very vague in their comments and answers. When we talk about labs, however, the doctor is good to expand and explain everything to help us better understand my condition. That helps us to better plan for our future. That's important to us. Sometimes it isn't enough explanations, which is frustrating. He is frustrated as well. On the other hand, the doctors would say each cancer patient, each clinic, each cancer patient. See, I'm tired. Yeah. Each cancer patient is different from the other. My cancer isn't the same as another cancer patient. It varies, so it's hard for doctors to provide a direct answer. I do understand that, but at the same time, it is frustrating for us. People will say there are some who have a high tolerance and can handle it, whereas some people can't handle it. They have no tolerance. In Chrissy's case, she has a high tolerance. That's why she looks fine. But emotionally and mentally, it looks different for each person. Exactly. Now she is reading what she has written to make sure she shares all her information. Yeah, I'm using a teleprompter to help me. This is my first time using this at home. Nathan has used it when he has expanded on different medical terms. It's really helpful. So when we are at home, I do see my girls processing their own emotions. Some emotions, they are very openly expressed. Other emotions are kept to themselves. Pumahana is very emotional. My husband tends to be very emotional, and I get it. He cares so deeply for me. It's hard on him, and he struggles when the doctor doesn't share a lot of information. I want to tell you the different dates for the rounds of chemo. The first phase of chemo are different from the second phase. The first phase started May 16th. That day is when I received my first round of chemo. This continued until August 8th. I will call this chemo A. Easy way to keep them separate. Now this treatment of chemo is different from the first treatment. The second treatment started August 29th until now and going forward. I will call this chemo B. Different drugs, different medication. Yes, the treatments are different. Let me explain why. If you watch vlog 10, it talks about chemo A, side effects, what to expect, things like that. My first treatment for chemo B was August 29th. Yesterday was my second treatment, second round. Moving forward, we don't really know how many rounds of chemo I will have. We assume it will be around about 6 rounds. After the 4th round, she will have imaging done again, CT scan, bone scan, brain MRI, same as before. They want to see if there has been any improvement, reduction of cancer cells with this new treatment. Technically, you need to complete 4 rounds before these images can be done and find out the results. We will probably get the results maybe in December. We will take it from there. After getting the results and how the whole treatment is going and how she is feeling. He has already explained what I have written. After the imaging was done, CT scan, bone scan back in August when I was having chemo A. That was after the 5th or 4th round. So you had 1, 2, 3, 4, 5. The first and second treatment, that wasn't chemo. The 3rd, 4th, and 5th was chemo. So after the 5th round, I had the CT scan. Yeah, you are right. The bone imaging to find out the results. Oh, also the heart. Yeah. They wanted to see everything to make sure we were on the right track. The breast cancer cells successfully reduced. Unfortunately, new cancer cells are showing up in different areas of my body. The HER+, the ER+, it's called metastatic. It's spreading. We already knew this would happen since the beginning. We recommend you watching vlog 10 if you have not already. That vlog explains a lot more. It includes slides and pictures as to where exactly on the body the cancer is. Nathan explained a lot. So vlog number 10 correlates with this vlog, number 11. Like I said, the cancer cells have reduced, but at the same time, not good since the new cells have spread. That's the reason for the change of treatment to chemo B. This treatment will focus on HER plus and ER plus cancer cells, killing and destroying those cells. Yes, redo, see if it works. As Nathan mentioned about the treatment, the next step will be the imaging again, probably around the last week of December. The imaging will let us know if we are on the right track, if everything's the same, worse, or changed. We are hoping the cells have shrunk. Okay, so regarding the side effects for chemo A and chemo B, you may wonder if it's the similar or different. The side effects are almost the same for both. For chemo A, feeling fatigue, diarrhea, runny nose, watery eyes. It's just watery, it's not yellow. Always need to have Kleenex around. We have had to buy a lot of Kleenex boxes. So chemo B, less runny nose, but still have watery eyes. So the difference for chemo A, I've experienced a lot of muscle twitching in my arms and legs. I feel like there's something stuck inside my leg. We wonder what it is. I still have that feeling since starting chemo A, and it's still with me with chemo B. I can feel it. Chemo A, I could eat anything I wanted. The doctor told me that I could eat whatever I wanted, so I'm doing my best to eat healthy foods and drinking a lot. So chemo B, I noticed after the first treatment, I didn't have much of an appetite. I ate very small portions. My stomach just felt really small. I did struggle to eat at the beginning, but after a week or two, I am eating more and more. I'm feeling better. But I've noticed I have gained weight, more puffiness in the face and body. The doctor told me the chemo has a strong dose of steroids in it that causes weight gain. So now, look at my face, how puffy it is. I see a picture of me and I'm blown away at how puffy my face and body is. I'm around 180 pounds or more. But the most important thing is that I am able to eat. So being on chemo B, I have noticed I am more emotional. I'm frustrated. I experience more mood swings. He's not used to me this way. He is always trying to help and support me. Sometimes I don't feel like myself. As I get up in the morning to get ready for work, I look at the mirror to put on my makeup. And when I see myself in the mirror, I don't recognize me. The face looking back at me isn't Chrissy. Seeing my bald head, that isn't me. I feel different. Yes, every morning I experience this. It is hard. It's hard on me. I know I need to stay optimistic and strong. I want to keep myself up and not drag myself down. When I keep myself up, I'm more productive. Overall, I will feel better. To help me maintain my optimistic outlook and stay strong, I focus my attention on house chores, going for a walk, at work during lunchtime. My coworker and I will go for a walk, grab lunch somewhere, and come back to the office and eat. Most of the time, if we eat lunch at the restaurant, we will walk afterwards. Sometimes I do experience fatigue in my legs, especially if we walk far. One time we went to the swap meet at Aloha Stadium. Good thing we took a picture of the stadium before they tear it down. That day was a perfect day. The weather was good. The sun was not beating on us. Of course, I wore a hat and had an umbrella. There was a slight drizzle of rain. My friend from the mainland came to visit me. Wow, that was so nice. So the three of us went to the swap meet and walked around. I had to stop sometimes to rest, catch my breath, and then we would start walking again. We need to use the bathroom. Now they have bathrooms throughout the area. Before there was only one bathroom. So nice now. I could quickly go to the bathroom and not have to walk too far. Walking is so important. It's about 1 mile. Yeah, that's enough, and then we could head home. I enjoy making ribbon leis. Sleeping. I love to sleep. Taking naps. I must sleep 8 hours. And most of the time I do sleep 8 hours, and I feel good when I go to work. I keep a daily routine. Most importantly is quality time with my family, my husband, my 2 girls. We play games like Uno. We've been doing that for a while. We go out to dinner, spend time together running errands, shopping, things like that. We take every opportunity we can to spend time together. Well, since I found out the results, this was before we moved forward with Chemo B. The results really hit me hard. I couldn't allow myself to shift my thinking and get myself down and feel depressed. That would make things worse, and I didn't want that. I have a family. He's there for me every day. He helps me feel I'm okay and I'm fine. Even my daughters will support me and stay with me. It's so nice. Every day I feel okay and I will be fine. He is my rock and my anchor. He is an amazing guy, really is. I really want to express my appreciation for all of you, wonderful friends, family, my sister, relatives. Your loving support, thoughts, and care for me. I appreciate all of you. I appreciate you. Really, you are all in my heart. Not just my family, but all of you. You are all a part of my life. Mahalo for texting, visiting, bringing meals for my family, gifts, prayers, and so much more. Your words mean so much. Thank you. Most importantly, I want to thank my husband and my 2 girls. I love them. They are a part of me. Thank you. One more thing before Nathan speaks. I want you to think of me as a Wonder Woman. Think that I will overcome cancer. I need you all. You are superheroes. Whoever is your superhero, label yourself that. By doing that, you support me. We are a team together. Help join the cause to destroy the cancer. Not just me, but for all cancer patients. Family, friends, all help to support the cause of eradicating cancer. Not only cancer, but other cancers like leukemia. Continue to fight for those people, your loved ones, and those you care about. I do encourage you to check yourself regularly, but also get regular checkups. If you feel something is wrong, mentally or physically, don't delay. Make an appointment. You never know. Most importantly, Most importantly, see your doctor. Don't ignore signs and symptoms. My experience has been if I feel something is off, I see the doctor right away. There are hidden symptoms we can't detect. I have always done self-exams. Over the year, everything is fine, and then I felt something was wrong. I went to the doctor, and that is when I found out I had cancer. If the doctor provides resources, please read them. If you don't understand the information, contact us and we can explain. Some of the information is hard to understand. We can expand and explain more. We will often read something that we don't understand and we'll call the doctor and ask him to explain. He sometimes will have to call us back through an interpreter and explain everything. So helpful. Don't wait for the next appointment. Go ahead and call the doctor and ask him to help you understand the results of a test or whatever it may be. Ask the doctor questions so he can explain. Then the next appointment, when you see the doctor, you can explain what you understand to make sure it matches what he has told you. Again, we are happy to help. We love you, and again, thank you so much for your support. You have had a chance to listen to her feelings and thoughts. The next round of chemo will be on October 10th. That day, she will have a Mediport placed under her skin. The Mediport will be placed in the morning and then in the afternoon she will have chemo. As of now, this is still tentative. This procedure hasn't been confirmed until we see the surgeon this coming Tuesday. We will get a confirmation through my chart in the hospital system if they decide to move forward with this. We are so grateful for your love and support that you have given us. Food, your words, your likes, stars on our vlogs, whatever it is. We enjoy listening and reading the messages. I know I need to reply more often. This isn't something I typically do. I tend to read and say to myself, oh, thank you. But I need to express more. Thank you for watching. I want to give you a surprise. You want to see my hair growing back? You ready? Kind of messy. White, gray, black hair. Bye. Love you all.